And now to our final segment, still with us here, we want to discuss Mpox preparedness here in the country, and we want to take it from a different angle, given that we have heard from the ministry the preparations that have been made. Now we want to get to know what are the health workers are doing in their various facilities, what are the various members down there, given that you do know that the health workers play a critical role. You do know that the role they played back in when the country was experiencing COVID-19. Now with the advent of Mpox in the country, given that Kenya has recorded a second case that was barely last week, of course, sparking new concerns about the spread of the disease in the country. So what measures have been taken? Joining us for this conversation will be Mary Christine Boniface, the National Treasurer of the Kenya Union of Clinical Officers. Mary, karibu sana.
Thank you so much.
And of course, on the other side is Dr. Cheriot Rotich, the Kenya Medical Practitioners, Pharmacists and Dentists Union Branch Chair of the South Rift. Welcome to the show.
Thank you.
Daktari, before we even get to the Mpox, just make a clarification for us. Yesterday we saw KMPDU declaring that there will be a strike. So is it a nationwide strike or is it a county-based strike?
Thank you, Abdi. I would like to clarify that the strike notice we've issued is specific to counties. Counties like Nakuru, Nandi, and others who've not paid doctors their salary for some months. Particularly during the duration when we were on strike. Remember that we ended the strike and the agreement, the return to work formula stated clearly that no doctor was to be victimized and all the salaries were to be paid. But some counties have not yet paid those salaries, and that's why we've issued a strike notice against them. And if they don't pay within that duration we have given them, we'll proceed on strike.
Okay. Now, going back now to the topic at hand, Mary, as the Kenya Union of Clinical Officers, are you prepared to handle these Mpox cases if it reaches that particular point?
For us, the Kenya Union of Clinical Officers is that we have members in the counties and spreading to the far end counties that are, I would say, marginalized. The farthest end of Marsabit, Wajir. We have clinical officers working in all those facilities, the level 1s, the level 2s, the level 3, level 4 facilities. And when something like this happens, we're literally preparing for, I would say, a pandemic. And because the WHO has already mentioned it as a matter of concern, we expect to see preparations in the counties, as the ministry has announced, in terms of sensitization, which should start from the healthcare workers. One, for awareness trainings in terms of what to expect from the cases that we should be seeing should the spread increase, and also preparations in terms of materials, supplies, the PPEs and all that. The ministry has said that sensitization has started, but again, on a slow note, because most of the members, and especially the ones that are those at the far end facilities, it has not happened. But again, we expect it to start at the very sensitive areas, these facilities near border towns or ports of entries. And in as much as it has started, we've not seen it being done aggressively, because again, we also don't know how fast the spread will be or how it will occur. Though the good news is that we've not seen as much cases so far, the two, but we hope in not a long time, the tradings will be done and all healthcare workers will be ready to tackle the cases as they come.
Okay, Daktari, give us a brief on what is happening on the ground. Especially, we have already recorded 2 cases, not just the doctors, but as health workers in the country. Are you prepared to deal with this Mpox?
Abdi, thank you. I would like to state categorically that we are not ready as members of Kenya Medical Practitioners and Dentists Union.
Tell us why.
We have seen a sluggish attitude from particularly the ministry. We've not seen the vibrant awareness creation by the ministry. Health workers have not been trained If you ask most healthcare workers what Mpox is, how it is transmitted, how it can be prevented, most don't, because this is it's a new virus altogether, and we have to relearn it afresh. And we've not seen the ministry making sure that we have awareness among the healthcare workers and also the public. We've only seen efforts by the PS of Public Health and Professional Standards, Ms. Mary Mudhoni, doing a few interviews here and there, but that has not disseminated information with regards to Mpox. And I would like to perhaps advise the ministry to take the attitude that CS Kagwe did when we were managing COVID. The daily briefs, it may not be daily for this particular case because we don't have many cases yet, but let us have weekly updates. Let us have sensitization. If you can remember, during that time, Kagwe used to sing and say, if we treat this disease normally, it will treat us abnormally. You can get it, I can get it. I'm sure you remember those phrases. We are supposed to have those phrases currently running on our screens. We are supposed to have sensitization messages, even on our bulletins. Do we have any at the moment? So I can say,
as a profession, what have you been able to do? Given that KMPDU is a union in itself, it is a professional body. So what have you done, given that it's already here, what have you done to educate and ensure that your members down there who will be handling these particular cases are ready?
Remember that we as a union, we ensure that our members are well taken care of wherever they are. We've spoke about this. I'm sure you've seen this in the news. We've spoke about the lack of preparedness as recent as on Saturday. The lack of preparedness and the sluggish attitude by the ministry. And that is what we have done. And I think going forward, we'll have mechanisms as a union of making sure that our members are well sensitized. And we'll be looking for partners to help us so that we move very quickly ahead of time. They say a stitch in time saves 9, and we need to do that now.
And maybe, Mary, we're talking about measures that have been taken to ensure, not just to secure the patients who will be arriving at the facilities, as well as the doctors, clinicians, the nurses who are working there. So what measures have been done, and what do you propose, not just to the ministry, but to we even saw COVID-19 various partners, both here in the country, private sector, were coming in to help. So what is the dire need as we speak?
The very first important thing that we need to do is information, because lack of knowledge can really mess us up. And this is knowledge across the board to the citizens and to the healthcare workers. So we really need to move very fast and invest in that, provide information materials about Mpox and especially its transmission, because it's there that we derive the preventive measures of the disease. And then other than after providing the information, then it's also ensuring the preparedness in terms of the things I mentioned earlier, you know, the medicines for the supportive care, the protective gears and all that. So just ensuring that we have those things that we need to manage the conditions and most importantly, the space, because we know these are cases that cannot be mixed with other patients. They need to be isolated. So we have these spaces in our particular facilities where we can accommodate these patients as they come. So we need to be all round prepared in terms of all those, you know, those things that we need to manage the cases. And then other than that is to improve on surveillance. That is ensuring that our entry points are well manned, and that we have teams constantly monitoring what is happening, because when we get the suspected cases, how are they being checked, the screening, where are they being kept as we wait for the results, for the confirmation and all these things. So for me, those are the first things that we need to ensure that we are ready with as we prepare to tackle the disease. Yeah.
Daktari, similar question. Tell us what is required in the health facilities across the country right now.
Thank you, Abdi. So I would like to put it in a more practical manner. That we can have a truck driver traveling from DRC or Uganda, and they pass the port after screening. Then when they reach, let's say he reaches Tito Ande and he falls sick, and they go to the nearest healthcare facility there. What do we need in that facility? So, and that is why we are faulting government, particularly the Ministry of Health, for this. So once this patient arrives, we need to ensure that the health facility is ready for that particular patient. Remember, we will need to isolate as per the guidelines, which again have not been clearly outlined by our ministry. Remember, ministry, the main ministry's role is to provide policy guidelines, particularly in management of diseases like Mpox. So we need to have county facilities activating the health management teams, activating the preparedness, readiness committees that we used to have during COVID. Let them earmark places for isolation of these patients, particularly...
Even the ministry clearly stated the other day we should open up those COVID-19, reopen them.
Yes. And then again, we're supposed to have all this supportive treatment that Dr. has explained. Over and above that, we are supposed to ensure that we prevent the spread of this infection by, of course, contact tracing and all that. And then finally, we ensure that we procure vaccines, which I think are now ready. We've had a shipment arrived in Nigeria yesterday, and Kenya should be at the forefront of making sure that we get vaccines, and we vaccinate the vulnerable populations, the truck drivers, the highly mobile populations, those who travel from port to port. We get them vaccinated as soon as now. Yes.
And of course, indeed, on that particular vaccination, we even saw the Health Director General, that is Patrick Amoth, clearly stating that Kenya will receive vaccines into the country, especially 2 million of them from Denmark-based Nordic Manufacturing Company by December.
December may be a little late. We want them as soon as now.
Okay.
Yes.
Thank you. Okay, Masi, still on the same, but the public, what do they need to watch out for? Given that you see Mpox, people have been confusing it with other diseases because before it manifests to the extent that we have been able to see those pictures and images, what do people need to look out for so that they cannot be infected?
Let me start from the point of mentioning out what the symptoms of Mpox will be. And majority patients will present with symptoms like fever, general body weakness, and some will have swollen nodes that, of course, someone moving in the public might not notice. The rash does not start immediately, may come a little late, and it starts on the face and then spreads to the rest of the body. But now, most importantly is the history of, this person who we are suspecting to be sick. Where have they been? Have they traveled? Could they have come into contact with someone who is sick? So the history might help a lot to help people in the public to get to know this person might be sick, and then they be able to stay away from them, because again, it's not easy for the public to be able to to say these symptoms look like symptoms for 1, 2, 3, until at that point where the patient develops a rash and everybody can be able to see and be able to tell. So the most important thing for people in the public or people out there going about their businesses is to, the usual precautionary measures of social distancing again.
Yes.
The habit of washing hands frequently, so that we can be able to avoid, because people can get the disease from contaminated service, so washing hands will come in handy. And then just being aware of your environment and you know, avoiding that contact with people around you will help a lot. Yes.
And Dr. you can see on your screen there, those are what Mpox at the end of the day, the results are. So how can we evade from reaching there?
So thank you. So we can avoid reaching there by, of course, prevention. And as we said earlier, the cornerstone of preventing any pandemic is awareness.
Yes.
Simple as that. Make people aware of the disease, how it is transmitted, and how that transmission can be stopped. So for this case, in Kenya, we are discussing human-to-human transmission.
Yes.
Remember, in places like the DRC, we are talking about animal to human. Remember, in DRC, things like rats is a delicacy for them. So for Kenya specifically, we are discussing about human-to-human transmission. And Dr. has clearly explained how we can be able to stop that transmission. Making sure that, of course, repeating again, kuosha mikono, na tungependa county haswa zile wako kwenye boda, Busia, Malaba, kwa Mombasa na wapi, county waweze kusaidia wananchi in public places kama stage ya magari, pale kwa port, kwa mahoteli, waweze kuprovide zile hand washing materials. Waweze kuhakikisha kwamba maji iko na sabuni iko. Hiyo ndo first line. Ya pili ni kwamba tusiweze kukula nyama ingine yoyote. Tuweze kula nyama mzuri. Na to minimize ile interaction na wanyama. Na nyama. Alafu pia ukiweza kusikia kuna mtu ambaye ako na upele, ako na rash ambayo imetokea kwa ngozi, uweze kuripoti ili huyo mtu akaweze kupimwa, na ikipatikana kwamba ni Mpox aweze kuwa isolated ama awekwe kando na wengine mpaka results ijulikane kama ni Mpox ama ni yale ndugu zake kama chickenpox, measles na vinginevyo. Tukifanya hivyo tutaweza kuhakikisha kwamba hatutapata cases nyingi za Mpox na hatutapata vifo. Na unajua hii Kenya pia hatutapata wale Mpox billionaires kama vile tuliona COVID billionaires.
Okay, we're entering the final leg of the conversation. Let me get your final remarks. Let me start with you, Mary. What should Kenyans expect, and what are they expected to do so as it does not reach to where we were back in the COVID-19 era?
I would ask fellow Kenyans to be vigilant. Even when delay of information from the ministry and the government is evident, we all have a responsibility of trying to learn as much as we can about the disease, and be aware of, you know, the prevention measures, and let's do it. Let's take it upon ourselves to ensure that we do that we need to do to prevent the spread. Let's ensure that we are aware of our environment, and like Dr. has said, if you see a rash, just report. Probably you know, the person who is sick is afraid of doing it themselves. Please ensure you do. And to our healthcare workers, we remain vigilant in our workplace. And this way we want to ensure that the workplace does not become the contaminant or the place where we keep carrying the disease, because it can easily happen. And just in case you're not provided with the materials that you're supposed to work with to ensure you protect yourself, then that workplace is not safe. And in that situation, we encourage them to stay away until what they need to see the patient is provided. Thank you.
And finally, Dr. your final remarks?
So my final remarks would be, let us take Mpox seriously as a country. Let us make sure we have a galvanized approach towards making sure that we give Mpox the attention it deserves, so that we avoid the complications that come with it. I would like to urge the ministry to engage all the stakeholders and make sure that any loophole that is identified in the whole process, whole chain of diagnosis and treatment is addressed. If we have a challenge in testing capacity for testing for the virus, let us address that. And finally, I would like to exit with a phrase from former CS Kagwe, that if we treat this disease normally, it will treat us abnormally. Thank you.
Bia moja na sausage mbili. You remember even that
Yes.
quote as well.
Yes.
Thank you so much. That is Dr. Cheriot Rotich, KMPDU Branch Chair of South Rift. Mary Christine Boniface, National Treasurer of the Kenya Union of Clinical Officers. Thank you so much. There you have heard it. You have heard it from the key stakeholders. It is because prevention is better than a cure. And finally, before we close off the show, as of yesterday, Africa recorded 3,953 new Mpox cases and 81 deaths over the last 7 days, bringing the total to 22,863 and 622 respectively. Information from the Africa CDC Director General, who clearly stated that this particular disease is a public health emergency. That concludes our conversation this morning. My name is Abdiaziz Hashem. The sign language interpreter at the bottom end of the screen is Brian Muraru. Up next is my colleague Nancy Okware with Kurunzi Mashinani. Don't go too far.